Hello, hello. Welcome, ladies. I am super excited to be hosting this conversation with y'all. We are live, child. If you got my email, if you're in the society, you got an update from me that tonight, we're here on official business. I am so excited to have this conversation with a really good friend of mine who has been. Child, I met Donna in 2016. Okay. And we actually had a podcast together called Your Health is Lit. Okay. Because she is a, first of all, Donna does all the things. She's a twin. Okay. Shout out to our good sis. She is a public health educator. She is just a woman of God, my good sis. And we share a passion for health literacy, particularly as it pertains to Black and Brown women. And so we are going to be having a conversation while y'all eat y'all lunch about Black maternal health. So I'm going to bring Donna on.
Hello. Oh my gosh, I'm so happy to be here. And I want to thank you for inviting me on your platform just to spread this good information.
Yes.
Sharla say we go way back. This is
So your
definitely
health is lit.
I know this is definitely giving me your health is lit memories. I was just actually crazy thing is I was just actually talking to one of my colleagues about our podcast that we had and stuff. And I just was scrolling looking at podcasts yesterday. And I was like,
Mhm.
I need to go back and listen to some of our podcasts.
Yes, like we were ahead of our time, ahead of our time. So tell us a little bit about yourself, what you're doing. Okay, we see the credentials. Okay, because let me tell y'all, we're so passionate about health literacy that we're both. Okay, I went to my doctoral program, and Donna is in hers.
I
Okay,
know.
and
Oh my God.
so tell us a little bit about your program, and then let's hop into this conversation about
Okay.
maternal infant health.
Okay. So I have my master's in public health and I'm a certified health education specialist. So a lot of my background has primarily been in health education. I have a passion for it. It's my love, it's my baby. Um, every time I kind of go outside of that health education realm, I end up being pulled back into it some type of way, some type of form. Currently, I'm getting my doctorate in public health. So I attend FAMU, Go Rattlers,
Okay.
diehard Rattler fan,
Okay.
with their undergrad masters back there for my doctoral. And I essentially took a break off in school. So I came back to school in 2019. And so I'm in that phase right now where I'm in that dissertation phase. So I am officially in candidacy mode. So that's amazing. So that means that I can present my dissertation probably in November. I am slated to graduate in December.
Period.
So we just
And we gonna cut up at graduation.
we definitely turn it up at graduation. And so I'm just super excited. And I'm so like thrilled to be doing this research because I was doing a research on something totally completely different. Like I wasn't even doing a research on this topic, even though I have a passion for infant mortality, maternal mortality when it comes to Black women. My focus was just on something else. And it's so crazy how my focus shifted back to that. And
God said,
yeah, God said, "Oh no, listen, I was trying so hard to make this topic work because I was doing human trafficking. When I tell you I was trying so hard to make human trafficking work, like so hard because I had just been doing research in it throughout my doctoral journey, and so it was just like no. I had even took a grant class and I was using the human trafficking to write a grant, and God was just like, sis, no."
no, this path though
Yeah,
is
he was
what I
like,
say.
no. So I shifted my research. So yeah, I'm super excited to be here and to share with you guys some of the research that I've been doing.
So can you tell us a little bit about what your project actually is. Like, what is your research project as it pertains
Okay.
to maternal infant health? What are you looking to prove as in regards to like your thesis?
Okay. So my dissertation is actually on doulas. So it's black women experiences who have used doula services. And so there's a couple things within my research that I'm really trying to answer, and I call them the specific aims. And so I'm really just trying to see what are the experiences of black women who have used doulas while navigating through the healthcare system. So I want to see, like, when the women are using these doulas, how are their experiences? Are they experiencing any racial biases? Do they feel like they're not getting enough information? Or because I have this doula here, do they feel like now I have this extra buffer? Is this person really helping me advocate for what I need, what I believe? We're also trying to determine if doulas decrease adverse health outcomes in Black women. So there is research that actually says that if you have a doula, you're more likely to experience less. You're more likely to experience less birthing outcomes, adverse birthing outcomes. So C sections. Also, low birth weight babies, premature babies, and then you're really more likely just to have an overall positive birthing outcomes or a more birthing experience. I'm also trying to determine if Black women experience racial discrimination slash bias while navigating to the healthcare system when using the doulas. So what I mean by like racial bias is sometimes, in the healthcare field, it's really hard for Black women, not even Black women, Black African Americans in general. I'll never forget when I was in class, there was this statistics, or there was like this little fact where like they took a poll of medical professionals. And mind you, these are medical professionals who are here to take care of us. And one of the facts that came out of it was like a lot of the medical students thought that Black individuals had a high tolerance rate, because I think it was because of their skin color. And so I was like, okay, these are the people who are actually caring for us. And even just talking to like some of my family members, my cousin, she told me how she felt like that when she was pregnant, like her doula helped a lot. And she felt like that some of the nurses kind of looked at her different because of her skin color. She was treated differently because of her skin color. And not everyone feels like that. But even me personally, I've never been in that situation, but I do have friends and family who have felt like that, even because maybe they were on Medicaid or something like that, and they feel like that they were discriminated against for being on Medicaid, and maybe they felt like that their care wasn't important versus this person who has commercial insurance and they're paying out of pocket. I also want to kind of examine Black women's perceptions of the healthcare system while utilizing a doula. And what I mean by that is sometimes when we have these individuals, for instance, the doula who is with the mommy doing the labor, does her perception change about the healthcare system or the type of care she is having? Does she feel like, well, I have this doula, so I'm going to receive better care? Or, oh my gosh, I had this doula here with me and everyone treated me nicely. Everything was roses and roses during my stay at the hospital, versus um or the mom could feel like, okay, I had this doula here, but that didn't change anything, I still was treated the same. And also because there's a lot of myths behind doulas, and I don't know if you can speak to it because you're in the healthcare field, you're a nurse, that sometimes when you have outside people who aren't clinical, because not all doulas are clinical. My mom can go be a doula, your friend can go be a doula, and sometimes medical providers sometimes think that doulas are overstepping, or maybe they're kind of like standoffish when they see a doula because they think that that doula is gonna kind of dictate everything or take over like the plan of care. So there's like even like a lot of myths about doulas, and I actually started reading research articles about trying to get like the nurses and the doctors on the same page with the doulas to let them know, like, hey, the doulas, they aren't here to take over your job. We want you to do your job. We're just here for that extra support.
I think that that's a really good point. Um, a friend of mine went through the process of finding a doula recently, and we talked about this as she interviewed. And it was important to me first that because I know just anybody could be a doula, that we had somebody with some sense.
Mhm.
Because you get people, and I think it's the case by case basis. I'm here for complementary medicine, I'm here for support,
Mhm.
I'm here for advocacy. And as long as we understand that the point is for us to work together, the goal is to have healthy baby, healthy
Mhm.
mommy, safe delivery. And while we have a plan that we hope it sticks to, the goal never changes,
Right.
right? Even if the plan changes. Sometimes what I've found, not even just with doulas, my doctoral program, I did this same kind of study navigating breastfeeding support for moms.
Mm.
And so what you find is you have a spectrum of everybody. You have a spectrum from like they only believe in complementary like stuff all the time. Don't take antibiotics for your ear infection, colloidal silver, and you have no medical basis or standard for that, right?
Right.
All the way to, and like those people who think that they can interject and think that everything that we do is wrong, I think that's dangerous.
Right.
For because they also have limited understanding, and all the way to people who work super well and can kind of navigate through, okay, although this change, let's still honor X, Y, and Z in your plan. And so I think that it really depends on the person. For me, my biggest criteria when I told my friend was like, find out what the regulations are in your state
Mhm.
and make sure that they've at least met those regulations. Because on the world of the internet, child, Chat GPT could
You can
be
go
your
to anyone
doula.
and get a
You can get
certification quick,
your yes,
fast, in a
we can
hurry.
put that certification fee down
Right.
for your Canva. So make sure make sure that you ask for credentials, whatever those credentials may be.
Mhm.
Make sure that if it's a lactation consultant, that they're IBCLC certified, or that they have a certified breastfeeding specialist certification, which is what I have. If they're a doula, make sure that they're meeting the standard of the state, because that's going to make sure that you're getting the best quality help. And also, it's going to ensure that they're held to some type of ethical and practice standard.
Right. I agree.
But child, it's doctors and nurses that be doing the most. So don't be
Listen, they be doing like the
they,
most.
they do the most and the least at the same time.
Listen, they do the most in the least. But even throughout this journey, like I've learned so much about doulas because like when I first started researching the topic, I knew what a doula was, but I didn't kind of know like really, really what a doula did.
Mhm.
Which I'm not sure if anyone's heard of the term continuous labor support. And so, continuous labor support is kind of what a doula does or what a doula offer.
Mhm.
So, continuous labor support is basically it's offered by providing supportive care during labor, and this care could be maybe emotional support, comfort measures, or information and advocacy. And so, when we talk about that emotional support, we're talking about being continuous present with the mommy, also giving like reassurance and praise maybe if the mom is having a hard time during the labor and delivery process, encouraging that mom, saying, hey mom, you're doing a good job, just trying to make her feel like empowered during the process. Because,
Mhm.
and I hate to say this, everyone has this stigma when it comes to labor that it should be like this painful thing. And I want to kind of get that stigma out of everyone's heads, because having a baby during the whole delivery process should be a beautiful thing. It should be empowering. It shouldn't be something scary.
Traumatic.
Oh,
Like
it
you
shouldn't
should
be
need a
traumatic.
yeah, it shouldn't be
Right,
traumatic. You're gonna have some pain, sis, because that's just
right,
part.
right. Definitely
We
gonna have some
we
pain.
take that up to her, but yeah, it
Right.
shouldn't be traumatic.
it shouldn't be traumatic at all. So you definitely want that doula there providing that emotional support, then information. And it could be information about your labor progress or maybe advice regarding like some coping techniques. Then we have that comfort measure. And what I mean by that comfort measure is that comforting touch, maybe a massage, maybe like a warm bath, encouraging mobility during the process. It could be promoting adequate fluid intake and output.
Mhm.
And then when we also come to that advocacy, which is something that I'm like advocate for, is maybe helping the mommy articulate her wishes to others,
Yeah.
because in that moment, that mom, she could be in pain and
Yeah.
she may not know her wishes. So that way, a lot of the times, even before birth, the mommy and the doula have like a birthing plan,
Yeah.
to go over her needs, her wants, her do's, her don'ts. And then really also, there is a lot of research that suggests that women who do receive the continuous labor support, they are more likely to give birth spontaneously. They're less likely to use pain medications or even have C-sections. And
Mhm.
then they're more likely to be satisfied and experience shorter labors. So there are
I
a
love
lot
that.
of benefits when it comes to the continuous labor support.
I
And then
have one.
you do tell
I
me.
have I have one that don't nobody think about. Let me tell y'all how risky these dads are in labor. When I tell you I did my senior rotation on L&D, and I was blessed because my
Mhm.
preceptor was the only nurse that did L&D, postpartum, and NICU. That's when I fell in love with the NICU. But she was like, hey, to me, I was continuous labor support as the student in the room. She was like, I'm putting you on dad duty. I had no idea what that meant. These men be dropping like flies. And now because they see the blood and the baby and they get lightheaded and they're down. I saw it once, and but I had to support several dads. And so even with the doulas, like being able to make sure that dad doesn't become a patient because now he done knocked his head on the ground, and we can focus on mom and baby. And even I feel like it also alleviates dad from that position. um I love my husband. Donna, you know your brother ain't no way. Andre,
Wanna
he
be
gonna he
someone
gonna
on the
kind of know
show.
what I want. He gonna have the best intentions, but in that moment,
Right.
him trying to advocate for me, now I don't have to worry about doing it. My husband doesn't have to worry about doing it, but we have this third party who's able to
Mhm.
provide us with that support. And so, on top of all of that, it's just an overall better experience for everyone.
Right. I totally agree. I definitely agree. And then even as being like a black woman, we see these stats that are crazy when it comes to infant mortality,
Hmm.
maternal mortality, even with different like celebrities. Like the story that always sticks out to me is the Serena
Yes,
story. You know, this woman has all the money in the world. She probably has access to some of the best
best
care,
doctors. Yeah.
best doctors, best
Yep.
nurses, but even Serena had to advocate and tell the doctors like something is wrong with me.
Yeah.
Like she had to keep saying that and keep saying that, and it's so mind-boggling that why as women, you know, we know our bodies, so why do we
Yeah.
have to keep saying that? Hey, something is wrong with me. Something is wrong
Yeah.
with me. And then so now we're having to worry about ourselves. We're having to worry about the baby. It's
Yeah.
just so
And I'm
much.
arguing with these people.
You arguing with these people, so it's just like this continuous labor support for doula is just so vital
Yeah.
for women of color, for black women, because we do experience higher rates of poor birth outcomes
Hmm.
than others. So I highly, highly recommend a doula. I don't have kids, but when I do have kids, I definitely plan on
Yes.
getting a doula. I definitely plan on doing my research. There's
Hmm.
different organizations that you can look into finding a doula. So it's just so much, but
Additional
I
support.
definitely recommend the doula for sure.
Yeah. I want to even go back to the Serena story because one of the biggest things that we talk about, and you touched on it a little bit too, in terms of like insurance, this and that. One
Mhm.
of those, the factors, the sets of factors that we see in research consistently when you talk about not only the Black maternal infant health disparity, but honestly, African Americans are at the top of the list for most disparities: diabetes, asthma. Just we
Hypertension.
have worse health outcomes in this country where we have robots and people going to space and doing Titanic dives. I don't understand. Anyway, Serena was outside of
Mm-hmm.
all of those triggers. So those social economics things, a lot of the risk factors are having low income, having
Mm-hmm.
poor access to health care, you not being as highly educated, and being obese, right? Because we like to eat all them zuzus and wham whams and everything our grandmama and them be cooking and it be fine. But like obesity, when you look at Serena, she had none of that. She is
Mm-hmm.
an athlete who is like affluent and has access to all of this, and she still had this problem. I think that, to me, that speaks even more volume, that it's not just poor Black women, it's Black women, period. Because now it wasn't just Serena at that time. Didn't Beyonce too?
I think, yeah, Beyonce. And then it was another. I can't think. There's like this famous judge. Her name is Kier. I can't think of her
Yes.
last name.
Judge Lynn.
Yeah,
Judge Lynn, her daughter-in-law died.
daughter-in-law. Yeah, that, and I look at, and it's, that was such a sad story. And her husband is actually like a advocate for infant
Yep, justice for
mortality and
Kira.
maternal
Hmm.
mortality. So it's just so sad. And even like doing a lot of research, like social economic status is not a protective factor. Like
Yep.
we know that
Yes.
it's not a protective factor. No
Yep.
matter how much money you have, it doesn't matter. Like it
Yeah.
just doesn't matter. And it's sad. And it's like, we need to advocate more, like what can be done. It's like, I'm so tired of like getting on social media, getting on
Hmm.
Facebook and seeing like, it's like, oh my gosh, okay, another Black woman has died doing childbirth or labor. Like,
Yeah.
it's
In
like, I'm tired of,
2023.
right.
It's
There's no
outrageous.
reason. Like,
Yeah.
we're a developed country. Like it's no reason. So it's like, what can be done? And I'm just really hoping like more Black women start using doulas. But of course, there are a lot of barriers to doula care
Yeah.
when it comes for that, when it comes to Black women and a lot of people in general. It's just that there's that lack of awareness of the doula services.
Yeah.
um, Medicaid, mothers enrolled in Medicaid, they have limited resources, not
Yeah.
being able to afford the out-of-pocket costs of private doulas.
Yeah.
And I actually, a part of my dissertation paper was, I had to do a policy analysis. This was doing my specialty comps, and it was so hard to like find information as far as like on doulas and healthcare plans.
Yep.
And a lot of the healthcare plans don't cover doulas. And I asked my cousin, I asked her, I said, do you mind me asking how much did you pay for your doula? And I want to say she told me in between $1,500 to $2,000 for her doula.
That's crazy.
It's
That,
crazy.
but you know what? That's consistent, because even
Mhm.
in my program, when we talked about health education, a lot of the
Mhm.
lactation education does not go beyond the 2 days that the mom is in the hospital, if they even get it, right? So there are all these barriers, despite being avid research
Mhm.
showing that babies who are breastfed have less incidence of illness, including obesity, asthma. They have better health outcomes overall. And because Black and brown babies are the ones that are at the top of the list with these disparities, it is crazy to me how little insurance companies cover preventative care measures.
Mhm.
They didn't even start doing and covering preventative care measures until my forever president, okay? Okay? Until the Affordable Health Care Act. So as much as people want to talk about like the negative of Obamacare,
Mhm.
what his legacy to me as a healthcare professional is that I can say in confidence to people, like, yeah, no, baby, you can go get your well woman exam
Right.
and it's not going to cost you a dime because of the Affordable Care Act.
Right.
But the fact that these insurance companies don't cover
Mhm.
preventative health measures bothers me to my core. Like,
Yeah.
bruh, it costs more money for that mom to be admitted into the ICU on mag drips and everything else for preeclampsia. It costs more money for that than it does for you to cover a doula. And there's clear medical research, right? Like, this is
Right.
why people like you and me have to be willing to step into these places, because there's no reason why insurance should not be covering lactation consulting.
Right.
State Medicaid, like state policies, should be covering this. Medicaid is a state policy.
Yep. And it's crazy that they don't cover it. And even like looking doing the policy analysis, like some of the Medicaid, so there's different Medicaid health plans, and
Mm-hmm.
some cover it and some don't. It depending on what type of plan you're on. For instance, I saw one plan that in order to get doula services, you have to have a chronic condition, a certain chronic condition to obtain doula services. And I think one was like diabetes or something like that. And it's just like, no, everyone should be afforded to have this service, which is why I'm just
Mm-hmm.
hoping that my research can say, here, this is the research, this is what I found. And then there's like definitely a gap in the literature, because a lot of the literature is solely from the doula perspective, which is
Yeah.
why my research is a little different, because I'm doing it from the
The mom.
women's perspective,
Yeah.
the mom's perspective, to see how they feel. Like, it's oftentimes that we rarely ask the individual, well, how do you feel about this? You
Yeah.
know? And
Yeah.
sometimes we need to get that mom opinion to see their overall experience.
Yeah.
And I've been collecting the surveys, and what I'm seeing for some of the surveys that I do have is that the moms, the women, they do want these services, but some can't just afford it because it's super expensive.
Yeah.
And again, doula services should be offered on all lines of insurance for free. It brings me back to something where I used to do a lot of work in the insurance world when it comes to health education. It's like, okay, you guys can provide like these health coaches and stuff to call all these members and provide these services. Well, why can't we provide a doula services to all mom that could potentially save the healthcare, save the health insurance money? But I don't know. I don't know. They're not looking at it that way. I'm not sure
I
why,
don't think
but it's just like,
they ain't
I
worried
don't
about
know
it.
who I need to talk to be like, okay, sir, listen. Like, I'm tired.
Because, and so that to me, I think, is my beef with healthcare. As much as I love it, and I'm
Mm-hmm.
grateful that God has positioned me in it, my beef and the things that annoy me is that sometimes I question whether or not we're here, like, for health.
Mm-hmm.
Right? We have those three tiers of care. We have the primary or the preventative, then you
Mm-hmm.
have secondary and tertiary care. Primary care is the stuff that happens before illness. It is to maintain your wellness, right?
Mm-hmm.
So to maintain the outcomes for not just mom, but these babies, because the mom, I worked in the NICU for several years. Black babies born earlier die sooner. Babies are dying, right? And so, having experienced that firsthand, it makes me really sensitive. I feel like I'm about to cry. It's making me mad. Like, babies are dying, and
Right.
that's not okay with me, and it shouldn't be okay with anybody. And so, having things like doula care and breastfeeding care covered as a preventative measure that we know brings forward help should be covered. But what
Right.
I find is that the system overall cares more about secondary care. Now that you have asthma, let me try to coach you. Why? Why?
Right.
Why? Even though that is valuable to help make sure people are maintaining their chronic illness, why did we let it get to that point when, the outcome could have been different? Not all the time. Asthma, there's several different factors, but that outcome had the potential of being different. Why do we wait until they're sick? Right? Like, let's talk about it. Some things happen. I have a genetic issue.
Right.
So that me having hypertension because of a genetic illness is different than the mom who has eaten herself into oblivion and now she has pregnancy induced hypertension and she's seizing.
Right.
The doula could have been talking to her beforehand and making sure that her nutrition was good and
Give
all
her
of that. And
resources.
because babies of moms with hypertension, they're born smaller.
Right.
Why are we waiting until we're at tier 2? And then tier 3 is like you have diabetes and now you have an amputated leg. And now because you have that amputated leg, you need physical therapy. Why are we only focusing on tiers 2 and 3? It really makes my mad. As my 3-year-old niece says, you making my mad. It makes my mad for
Right.
real. As I get further and further into my career, I've just had it on my heart to do more things, which is part of the reason. First of all, because I love you and you my sis, but I wanted us to have this conversation
Right.
publicly because I don't think that there's enough conversation with the moms, with the women who may not be moms, but you could be an auntie like me who may not necessarily have a health background, but you at least understand what's going on. You could be a friend and you could be there to be able to advocate for your loved one because I've had to do it with with credentials.
Right.
And Donna, I don't know if you remember when my dad got into that accident.
I remember. I remember that.
Yes. That hospital almost killed my dad. And had it not been for the fact that I had enough education and I knew how the health system worked, my
Mm-hmm.
dad may not be here. And I'm grateful to God that I had the knowledge. But what about the people who don't?
Mm-hmm. Yep.
Right? So even when we talk about navigating the healthcare system, here is what I want everybody to know. Always ask to speak to whoever else is in charge.
Mm-hmm.
Like understand that there is a hierarchy. There's the patient care tech. I've worked in most of these positions. The patient care tech, the nurse, the charge nurse. Then there is the hospital, like the house. They call them the house manager or house supervisor, who's in charge of every floor in the hospital. The attending physician. There's a difference between a resident and an attending physician. Like we don't have, because it's something that we essentially pay for, you can find another doctor.
Right.
Understand that there's risks and things like that related, but by the time we left that hospital with my dad, I called the chief nursing officer of that hospital and was like, let me tell you what happened, ma'am.
As you should. As you
Right?
should, because we got
But
to advocate for ourselves.
yes, but
But
we have to know how to navigate
Mhm.
the system appropriately. And so don't ever be afraid to ask questions. I don't care what bullying tactics or what threats you receive. I always ask to see policy. Can I see the printed policy? No, for real. Can I see the policy?
Listen, I'm that person to call corporate real quick.
Can I see the policy that says what you're telling me? Can I see the data? And when they can't produce it and they out here like Porky Pig, oblique, 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 exactly.
And you said something
Exactly.
really important. What kind of stuck to me? Don't be afraid to ask questions because sometimes, like, we'll just take the doctor word. That's what the doctor says. That's all.
Mhm.
That's it. That's what I have to do. Ask the questions. Like I can't stress it so hard because
Yes.
sometimes we'll be intimidated by like
Yes.
a doctor or our nurses,
Mhm.
or they'll just kind of like say,
Yeah.
"Okay, this is what it is. Bye,
Yep.
go." Mm-mm.
Don't
If you have a
and
question,
yes,
ask that
ask it.
question. Ask
Yes.
it.
Ask it. Hey, can you explain to me this in more detail? I have a reputation because I explain before you even have to ask, "Hey, look, I think it's this." When I see people in clinic, I'm like, this is how this works, like allergies. Because a lot of parents are like, well, does that mean that their immune system? I'm like, no, it means that their immune system is hyper responsive. So the same way that their body responds to viruses and bacteria, people like your child and me, it's like also pollen. We'll run up on pollen too. Like your blood system is hyperactive. And
Right.
I explain it like that. And the parents are like, okay, that makes a lot of sense. So no, you don't need to go hype your baby up on elderberry. They just need not that there's anything wrong with elderberry. I'm like, you can still give them the vitamins. So it's like I
Right.
encourage you to, but it doesn't mean that they have some type of like immunological deficit because they have allergies. It actually means that their immune system is about their life.
Right.
right? And so ask the questions, ask for them to explain it to you. A lot of times we have handouts and patient education tools, but people don't ask. And it's not even just Black people. Research shows that people who are of like Asian descent
Mhm.
oftentimes just nod and agree, and they may have questions and they experience um, a lower quality of care because it is within their culture to just
Mhm.
kind of like, okay, okay, thank you, okay, okay, thank you, right?
Right.
And we don't have to have that. We
That's it.
don't have to have that. So
Yeah.
can you tell us a little bit um just about some more of the interesting facts that you have gathered in your research,
Okay.
and um, what you want to see from your research 10, 20 years from now?
Okay. Perfect. Um, so some cool things that I've seen when doing my research is just again going back to that policy analysis where like there has been certain bills that have tried to be passed with getting doula care, and essentially like I don't understand why, but a lot of them have failed. Um, at the floor, even when there have just been like different facts to, back it up, like why it's needed. I'm not sure if you're aware of this. There's this program called Healthy Start. I know
Hmm.
that they do a lot of cool things when it comes
Yes,
to doulas. I know in Tallahassee, Florida, I believe it's called Sister Friends, and it's really, really super cool. They have like this program where it's kind of like a big sis little sis, but it's for pregnant women,
I
which is
love it.
something that I thought was cool, which is something that I didn't know anything about. But sometimes you just need that kind of big sister to be with you, someone who's more experienced, who's going through the birthing process, who knows like this is what you may experience, this is what you may not experience, but just knowing that I'm here for you throughout this moment. A lot of things that I had discovered, which I talked about a little earlier, where there's like a lot of literature that does prove that having a doula decreases adverse birthing effects, again like those c-sections, like those preterm birth, those low weight babies, something that I had never knew. I never would have expected, like, okay, like this doula can do all this or
Hmm.
help or assist and do all of this,
Yep.
because she's helping with that mom before she even goes into labor by,
Hmm.
again, like you said, providing her those resources. I did an internship with this doula organization as well, and I just found like out a lot of things of how like everything operates when it comes to doulas. And I kind of learned like, why like also there is a lot of doulas, but there's also some barriers to women's who are doula. I never knew like doing like when it comes to like the money process for the doulas, how some doulas they won't get paid until like the whole birthing process is complete. So like
Hmm.
if that's your only source of income, that kind of
Yeah.
discourage a lot of women for getting into like the doula space and the doula field.
Yeah.
Um, so
And they
yeah,
help postpartum too. Like,
so that's another thing. I never knew that there are a lot of type of doulas.
yeah.
There's like a deaf doula. When I
Yes.
was doing research, I was like, what? It's like a lot of types of doula. And I was like,
Yeah.
I never heard of a deaf doula.
Death
You
doula.
would be surprised of how many doula, how like all the types of doulas, because we only hear about like both birth doulas or those
Hmm.
postpartum doulas. We never hear
Yeah.
about the other type of doula. So
Yeah.
that was something that really, really, really shocked me, because I was like, a deaf doula.
A death
I
doula,
was
I've heard of
like,
that. Probably in a documentary I watched, a death
you
doula where they
did?
just come and, like, help with the grieving process and all of that.
Right. And
Mhm.
so I thought that was pretty cool. I was like, that really kind of blew my mind. Um, so yeah, but again, I'm just like so excited to do like this research, and really my study overall just really attends to examine the role of doulas and their impact on the birthing outcomes and experiences of Black women. I'm only doing it in Florida, just because we didn't, it just would have been like so much to like open it up to different
Mm-hmm.
states. So we kind of contained it to Florida. You know, a lot of crazy things happen in Florida.
A Florida man.
A lot of crazy things happen in Florida. And so I'm also doing this research because I want to understand the experiences of Black women who utilize doulas, but I want to hear their personal stories, which
Yeah.
could, you know, provide insight and could bring a greater awareness about the doula services.
Yeah.
And something that's cool about my research is that it's a mixed methods research. So what I
Mm-hmm.
mean by mixed methods is that I'm doing qualitative and quantitative
Quantitative. I love
research.
that.
So I'm doing surveys and then I'm also doing interviews, which I actually have a lot scheduled this week. I'm actually doing interviews because I just want to kind of bring in that real world approach and actually include some of the women saying
Mm-hmm.
verbatim in my study just to make it more like real and for them to, you know, really see like this is what these moms are saying. This is what they need. This is what
Yeah.
they want. Why aren't we listening to them?
Yeah.
And then my research also is going to bring that unique contribution to the research of doulas. You know, again,
Yeah.
there's a lack of research of the literature from the women's perspective. So, you
Mm-hmm.
know, that this research is going to be out there, and I'm hoping to get my research published in a journal article once I'm finished with everything. And then, really, this research is just going to improve equity in maternal and infant health outcomes and hopefully aid in the development of policies that will include doula as a necessary part of the healthcare system because we see it in different literature that it is needed. And I'm hoping that my research shows, and I feel like that my research is going to show like this is what the women want. These are some of the barriers that women experience when trying to get
Mm-hmm.
care. And if we see these barriers, then hey, we have something to work with to try to eliminate or decrease these barriers.
Mm-hmm.
And then just to bring again overall awareness to doulas and just looking at some going in, looking at some of the surveys I just saw, you know, a lot of the women didn't even know what a doula was or where to find doulas at. So I'm just really overall hoping to advocate for women of color because oftentimes like we are not heard, and I just want the women to be heard, the mothers to be heard. So I'm super excited about this, and I'm hoping even after my research that I can continue um, with this research, can continue advocating for mothers,
You
continue
better be on Capitol Hill changing policy.
changing the policy.
Okay,
And
no insurrections, but we will change policy.
and because my overall goal, and I know we talked about this a lot, is to open up a wellness center for moms,
Yep.
especially women of color, not even moms, just women in color in general, providing like different wellness classes, even classes about financial, because we don't like
Yeah.
financial
That's a
wellness,
part
is
of
a
a
big
social
part of public
determinative
health,
health.
a part of
Yeah.
the social determinative health,
Yeah.
financial literacy classes, um, health educational classes about nutrition, different chronic conditions, mental health and wellness, because that
Yeah.
is a thing, especially for my Black women. Like, take some time out for you, sis.
Okay.
Please,
A
sis.
nap.
Look, please, sis. So yeah, I'm excited about this research. I'm so excited for you having me on your platform. And if any women you know have used doulas, live in Florida, I don't know, Charlotte, we're gonna have to get this link drop or something or
Yes. Yep. So I will share it actually in the notes of this
okay.
video. If you are part of my email list, child, you got the blast today with the link. So definitely check your email if you haven't already. Please do the survey. It's super helpful. As someone who's done research, the more people that we hear from, the more accurate our research is, and we're able to just really honestly prove our point.
Right.
Right?
Mhm.
We're able to prove our point, and doing research and having these things published allows us to say, no, like for
Right.
real, we're not just fussing. This is data. We can kind of back up what we're saying, especially as we are in this space, not only just as Black women, but Black women of faith who
Mhm.
are helping and wanting to help the world be well. right? Not just big pharma, which is a whole nother topic for another day, but well in terms of like making sure you have the support that you need. The concept of having a doula is not new now. It's something
Mhm.
that you can even trace back to the Bible, child. Like they had people helping with the birth and the babies. And so we really have a heart for God and his people, and we have to be willing to go into the spaces and do the research and do the things. So I'm super proud of you, friend. I love you so
Thank
much.
you. I love you so much, and I'm so
I
happy
love you, child.
to come over
I'm I am going to again share that link. Donna, can you let the people know where they can contact you, follow you, do the things?
Yes. Okay. So I am on Facebook and it's just my regular name, Donna Williams. I'm also on Instagram. It's everything Donna Ray. And yeah, I'm super excited. And I
Yeah,
have a lot of great things in the works as well. School has been schooling, life has been
lifing.
lifing. Um so much, but I'm just in the, creating, and I'm hoping to do something with health education, creating like a website just to provide different tips on like wellness. So that's in the works. But again, school is life.
Yes, come on. Come on.
School
Well,
is
sis, thank you
life.
so much for taking the time to share with us just all about your project. I loved having this conversation. It's giving me your health is lit
I know.
flashbacks.
I know. We need to bring a special episode or something.
We're gonna have to do something on a more consistent
Yeah.
basis because I was like, this is all we did.
I
We
know.
had a good time. But yes, so thank y'all so much for watching and sharing your lunch break with us. Y'all can comment in the video below, take the survey, and I hope this sparks a conversation with you and within your circle about Black maternal infant health. Some steps that you can take if you've been thinking about being a doula, you know what I'm saying? Like just go out and do as the Lord leads what he's called you to do in this dispensation of time. Cause me and Donna can't do it all ourselves.
Can't do it all.
Okay. So I love y'all. I will talk to y'all later. Bye.
Bye.